Blood-borne pathogens, BBPs, are microorganisms such as viruses or bacteria in the blood and other body fluids that can cause illness and disease in people. The Occupational Safety and Health Administration, OSHA, established training standards and safety practices to protect the worker from diseases transmitted by blood-borne pathogens. This training is required annually and extends to a wide variety of professions, including first aid responders, cleaning crews, public safety personnel, healthcare, and other workers. 4 conditions must exist for a BBP transmission to occur. 1. A pathogen is present. 1 person is infected with the BBP. 2. There is enough of the pathogen to cause a disease. Not all body fluids contain the same amount of pathogens. 3. A route of transmission. There must be a way for the infected blood of one person to get into another's bloodstream. 4. A person is susceptible to the virus. The BBPs of primary concern are the human immunodeficiency virus, HIV, hepatitis B virus, HBV, and hepatitis C virus, HCV. HIV attacks the immune system cells and eventually causes AIDS, or acquired immune deficiency syndrome. There is no cure for HIV. The Center for Disease Control, CDC, estimates that more than 1 million people in the U.S. are living with HIV infection, of which 1 in 5, or 21%, is unaware of their infection. The incubation period from HIV infection to AIDS could be over 10 years. The symptoms vary, but often include weakness, fever, sore throat, nausea, headaches, diarrhea, swollen lymph glands, weight loss. Post-exposure testing for AIDS should be completed within 72 hours and then periodically for up to 6 months. The HIV virus cannot survive outside the body for very long. This is unlike the HBV and HCV viruses that can live outside the body for days. HBV and HCV both attack the liver. HBV can lead to serious conditions such as cirrhosis and liver cancer. Many people with HCV and HBV have no symptoms, or they may be very mild and flu-like. Loss of appetite, nausea, fatigue, muscle or joint aches, mild fever, headache, and/or possibly jaundice. The only way to know if you are currently infected with HBV or HCV, or if you still carry the virus, is to ask your doctor to do a specific blood test. There is no cure or specific treatment for HBV, but there is a vaccine to prevent HBV. There is no vaccine for HCV. Employees who have routine exposure to BBPs, even part-time and temporary employees, must be offered the hepatitis B vaccine series at no cost to themselves unless they previously received the vaccine series. Antibody testing has revealed an immunity. The vaccine is contraindicated for some medical reasons, such as an allergy to yeast, which is in the vaccine. The vaccination process includes a series of 3 shots. The second shot is given 1 month after the first. The third shot follows 5 months after the second. This series must be offered at no cost to the employee during work hours and within 10 days of an assignment to a potential exposure to BBPs. Employees may opt to decline the vaccine, but they must complete a declination form. Employers must keep these forms on file so that they know the vaccination status of everyone who has a potential exposure to blood. The employee has the right to change their mind at any time and take the vaccine. HBV vaccine side effects are mild. The most common symptoms are bruising, redness, headache, localized swelling, and pain at the injection site. Severe side effects include allergic reactions. If this occurs, seek medical help. OSHA attempts to reduce the risk and exposure to BBPs to employees by instituting several strategies, including universal precautions, personal protective equipment, PPE, engineering controls, workplace practice controls, and administrative controls. Your employer is responsible for the cost of implementing these practices, and as the employee, you must conform to the policies.